Hello, hi. Today our topic is DNP student avoiding the three most costly mistakes. Now, the initiative to create this video came from the hundreds of DNP students that I've worked with, and these are three common mistakes that I've seen them made, which have cost them sometimes to stay longer in the program. Some have dropped out of the program, or some get frustrated while they're in the program. All right. So my name is Karen Danvers Perez, and this video is for educational purpose only. So number one mistake, not having a clear project idea. Now, before even being admitted into a DNP program, a lot of times the interviewers will ask, what ideas do you have for a project? This is important. You need to have an idea of what area, what specialty area. For me, I'm a nursing educator. That's my specialty area as it relates to education and teaching or nursing academic. In the clinical aspect, I'm a gerontological nurse. I see patients who are in the gerontological field or area. So most of my workplace takes place in academic. So I know I'm not going to have access to patients in the clinic. So my topic, my DNP project was focused, I know it's going to be on nursing students. All right. So that's a general area. So as I mentioned, one of the most significant mistakes DNP student makes is not having that defined. And I know I have well-defined here project, but it doesn't have to be well-defined. Just have an idea on a whole. What is it that they're going to be doing for their project? You must have some form of idea. Here's what happens when you don't have an idea of what you'll be doing. This lacks clarity and it will result in you wasting time and wasting effort. Here's why. While I was doing my DNP, what I did is that I know my focus is going to be on nursing education. So most of the papers that I write, most of the topic that I wrote about was on nursing education in some format as much as possible. When I have to do my concept analysis, my concept was on a term that is used in nursing education. So not having that, not having an idea of what your topic is going to be about, you're going to write about falls one day, then you're going to write about diabetes another day, then you're going to write about hypertension the next day, and you're going to be looking for research articles to support whatever paper you're writing on. So by the time you're finished doing 3-4 classes, you have tons of paper on falls, hypertension, diabetes, all right? Versus if you have an idea of what is it that you want to do, you know it's falls, but you don't know what unfold is yet, but you know it's going to be surrounding falls. That means most of your coursework, your scholarly assignment will surround the topic. So articles that you'll be pulling will be on falls, all right? So here's the solution. DNP students should take the time at the beginning, even before the program, because they're going to ask you that in the interview. Do you have an idea for a project? So have an idea of what your project's going to be on. It will save you a lot of time, save you a lot of stress. Number two, not identifying the problem at the practice site. So a lot of times nursing students or DNP students have a concept in their head what they think the problem is. So they'll say, okay, I'm going to do something on fall, but does the facility have a problem with patient falling? Or I'm going to do something on hypertension. Does the facility have a problem with the patient with hypertension? You need to know that, because if they're not having a problem, your project will mean nothing. But here's what's going to happen. If the practice site doesn't have a problem that the nurse designed to implement her intervention on. So say that you say, I'm going to implement a falls scale to decrease falls in the long-term care setting, for example. Remember, you have to collect data. You have to, because that's how you're going to measure if your intervention worked. So you have to get information such as how many falls per year, how many falls per quarter, what is already in place, do a root cause analysis, and what is the cause of the fall, and all of that needs to be done. So when you go and do that and you see that, okay, they don't have a problem with fall. They only have one fall per quarter or one fall per year. Now, you're not going to get any data to support if your intervention work or not. So that's why it is important to make sure that you identify that this practice site is having the problem, and you need to do your assessment and your investigation instead of just coming up with a problem in your head thinking that, okay, they have the problem. I've experienced with a student who have gone through so many classes, reached the end, said that she's going to do an intervention. When she looked, the facility already has that intervention in place. So she now have to revamp her entire project, getting new articles. So make sure that you identify that the practice site had the problem that you're trying to solve, all right? DNP students should actively engage in their practice site or clinical setting to identify existing challenges or areas that need improvement. You cannot decide that you're going to use a tool or implement some processes without identifying that the clinical site or practice site have a problem. Number 3, not conducting a comprehensive literature review. And I say comprehensive, throughout your DNP program, you're going to be searching the literature often. So by the time you reach close to implementing your project, you should have a vast amount of evidence to support what you're saying. But here's what's common. The DNP student think of something that they think will work. And then they think of it, then they go look in the literature for evidence that support what they think will work. They've heard of a tool, and then they say, oh yeah, I've heard of this tool. It's going to work. Let me just look for something to support it. That's actually doing it backwards. So the clinical site is having a problem, and that's where you write your research question from, your problem statement. This is the problem. Now, you're going to look in the literature to see what can fix this problem, because you have to have evidence that supports that it works. So there are organizations like the American Diabetes Association that has toolkits that can be implemented. And people have done research on it and show that, hey, it actually decreases hemoglobin A1C and work to improve patients' health. There are other research that nurse scientists have conducted research to show that, for example, giving ginger tea prior to chemotherapy will decrease the amount of pharmacological medication used to reduce nausea and vomiting. All right. So you want to make sure that you look in the literature and have the information of what supports your project. And you're not doing it at the end. You're not thinking that, okay, I'm going to look for a fall scale. And then you go look for evidence to support it. You have your problem statement. You know it's a problem. Then you should search the literature for what to fix that problem using your PICO question. If you have not seen the video on how to formulate a PICO question, please feel free to watch that video. All right. So these are the 3 most common mistakes that our DNP student makes. So our solution is you should invest time in reviewing the literature to identify gap knowledge and understand what has been done and identify what works and what approach would be best. Okay. So in conclusion, approach your scholarly project with a clear sense of purpose, a well-defined problem to address, and a strong foundation in existing literature. And again, make sure that you have a clear communication with your faculty, your advisor, and your mentor. Because one, you don't want to start the program and then drop out because of miscommunication. And You don't want to get frustrated because remember, when you're doing your DNP, you're working at the same time. You're working, you have families. So you want to make sure that you are on a strong foundation. So by avoiding these common mistakes, students can increase the likelihood of successfully completing their project and making meaningful contribution to the healthcare practice. All right. So here's a resource that I'd like to show you. I wrote this book, Pico Question Made Simple. This book serves as a guide to craft effective Pico question, and it's designed as a go-to resource. It offers invaluable support to both students and professionals who struggle with formulating a Pico question. What a Pico question does, formulating a Pico question will help you in guiding your literature search. Okay, how to search the literature. So in addition to having Pico question, this have about 200 examples of a Pico question. In addition to that, it has topics that you can do for your DNP projects. Not only the DNP project, but whether you're in education and you have to do a project, a quality improvement project, law enforcement, any other division, this book is very useful. I'll put the link below that you can pick up this book. So thank you so much for watching and looking forward in hearing from you how this video has been helpful. Thank you.